When a doctor asks if you are sexually active, what do they mean? You fucking? It's not just P and V. Oral and other sexual activity can cause STIs. It means all sex stuff. Do you have sex? Oral, anal, vaginal, anything sexual that you do with other people. That's what they mean. It means any sexual contact, including oral and anal, or even just hands. Just say yes. Are you sexually active? No, I just lie there. Just tell your doctor exactly what you wrote here. Like literally, use those exact words. Have you done anything that could expose you to STDs, STIs, and is it possible you could be pregnant? I don't know, but saying not at the moment. I tend to give it a rest when leaving the house doesn't get a very favorable response. As a medical provider who works in women's health, I need to know how you have sex oral, vaginal, anal, and how many partners. We ask so we know your risk factors and whether we need to rule out sexually transmitted infections and pregnancy. We literally don't care if you've had sex with 0 or 100 people. Honesty helps us determine how best to treat you. There is literally no judgment however you answer, just please be honest so we can help you appropriately. Also, if they ask what you take include any illegal drugs. 1. They want care. 2. It could explain a blood test or other health concern. 3. Also include if you are in recovery talks from illegal or illegal drug or supplements, even on your own. Are you active during sex? Like, do you run around, get a good workout? Is you fucking or no? You know, sexercise and stuff. No, she replied. I just lay there. They want to know if you are having sex or have had sex recently. They want to know if they need to consider pregnancy or an STI as a possibility. In general, the term sexual activity when used by a professional describes penetrative sex of any type, including giving or receiving oral, touching, rubbing, or otherwise interacting with the mouth, anus, or genitals. Generally, doctors ask because being sexually active is a risk factor in many areas of health, even if only a minor one. This may not always be an immediately important fact for a healthcare professional to know, but it could be absolutely key in future health concerns and decisions. All that being said, you can always clarify as much or little as you are comfortable with, and that includes simply saying that you are not comfortable discussing the issue at this time. Naked jogging on the treadmill, nude powerlifting, biking without bike shorts, etc. It's a vague question and could be worded better. I'm in the medical field, and when I ask that question typically I mean within the past 6 months, have you had any contact involving genitalia yours or another's? For women of childbearing age I typically word it as is there a chance you could be pregnant? Equally important to know with certain medical conditions. They are asking if you have performed any of the following since your last visit. Penis in vagina, mouth, anus, vagina in mouth, anus in mouth, any exchange of body fluids. To determine you need to be tested for pregnancy or STDs and possibly to educate you about birth control and safer sex. They don't care about handjobs. It's also dependent on your age for mental health reasons. The doctor is the person you need to be fully honest with. There is no shame, just be honest. Yep, I smoke. Yep, I had a gangbang. Doctors have heard it all.